We started using GS1 standard to monitor the AstraZeneca COVID-19 vaccine, in particular Covishield, for product identification. This was, that is the vaccine from the Serum Institute. Identification of the vaccine was at the level of the secondary packaging using the GTIN, the batch number, expiry date, serial number, and so on. We did assessment of the movement of the vaccines using the global location standards or numbers, and we were able to scan or to trace and track and trace the vaccines for across more than 400 facilities. The scanning, of course, was done across the location where the GLN or global location numbers were assigned. You can see that this map shows our relative but good success in terms of scanning upon entry at the airport. As you're going to see in a couple of slides, we restricted the airport to one entry point. And we were able to scan across 34 states. 2 states we missed because things were, kind of in a panic mode at that point. Scanning was also detected to local government cold stores and healthcare facilities where the secondary barcode coding was still intact. You can see from here the point of entry was the National Azikiwe International Airport in Abuja, and from there to the Central Cold Warehouse in Abuja, just a mile away from the airport. And then we scanned at the state warehouses, local government, healthcare facilities, and then to recipients. What we have not been able to do because of the secondary packaging labeling is to the recipients. And we are thinking in the future of point of dispensing serialization so that we can do end-to-end. NAFDAC has also participated in the Global Steering Committee for Traceability of Health Products. We have nominated representatives in the steering committee, we have representatives at the technical endorser group for the Global Trust Repository, GTR, and also in the data sharing high performance tax team. Nigeria is also selected for early adoption of the Global Trust Repository and is represented in the country development tax team, collaborating with National Primary Health in Nigeria to perform limited testing of the GTR app. We are also providing support to the project management PMU for documenting the assumptions, budget, and business processes for the deployment of GTR. In-country serialization, this is just an example. We were able to do in-country serialization of Moderna. We had 7 batches. It was 4 million doses. And you can see that there is no serialization at the upper part, the upper picture. And then there was serialization as shown in the lower picture. The expiry date encoded in the barcode on the vaccine secondary pack did not comply to GS1 standard. That was why we needed to do in-country serialization. We also were maybe about a week plus ago, we finished in-country serialization of Pfizer-BioNTech. We had 5 batches of about 3.6 million doses. Again, the diluent was serialized, but the vaccines were not. So we had to serialize the vaccines. The GS1 2D data matrix barcode on the secondary pack did not include serial numbers. Again, that's why we had to do serialization. Pfizer agreed. We met with Pfizer through Ulrike arranging a meeting with Pfizer France, and Pfizer agreed to receive our serial numbers that we created in country. to enable the traceability in Nigeria to be on their records for future use. The procedure for serialization, in-country serialization was very, very simple, but very sensitive to the cold chain. It involved preparation, of course, the serialization, commissioning. These were all outside before taking the vaccines out of the freezer. It was at the point of labeling that we quickly pulled the vaccines out, and it took only 2 minutes so that we will not break the cold chain. So that is what we have done in terms of activities.